You wake up in the morning ready to tackle the day, but your joints scream in protest. Sound familiar? Well, what if told you there's a way not just to manage arthritis, but to repair damaged cartilage? Yes, you heard that right. Today, we're diving deep into the world of joint health, unveiling groundbreaking strategies to fix arthritis at its core. So, are you ready to bid farewell to pain and reclaim your freedom of movement? Because we're about to revolutionize the way you think about arthritis. Understanding cartilage. Cartilage, often overlooked but crucial, acts as nature's cushion within our joints. Picture it as a white, shiny material that covers and protects the ends of bones where they meet, ensuring smooth movement. Not only does it provide lubrication for frictionless motion, but it also absorbs shocks, preventing bone damage during everyday activities. However, when cartilage is damaged, visualized as holes or craters on its smooth surface, the consequences can be severe. Untreated cartilage damage leads to stiffness, swelling, and excruciating pain, hindering mobility and diminishing quality of life. In advanced cases, joint replacement surgery becomes the last resort, replacing natural cartilage with artificial components. Understanding the importance of cartilage is the first step towards preserving joint health and preventing debilitating conditions like arthritis. Recognizing symptoms of articular cartilage injuries. Articular cartilage injuries manifest through a spectrum of symptoms, often impacting joint function and mobility. Key indicators include pain and swelling. Affected joints may exhibit localized pain and swelling, indicative of underlying cartilage damage. Catching sensation. Individuals may experience a sensation akin to catching or snagging when bending or moving the joint, signaling potential cartilage irregularities. Audible and sensory changes. A crackling, grating, or popping sound and sensation during joint movement can signify cartilage deterioration or roughening. Joint locking. In severe cases, joint locking may occur, characterized by an inability to fully extend or bend the joint due to cartilage abnormalities. Instability. A feeling of joint instability or susceptibility to giving way may arise, impairing functional mobility and confidence in joint integrity. Stiffness and reduced range of motion. Cartilage injuries often result in joint stiffness and a diminished range of motion, hindering everyday activities and physical performance. Treatment of articular cartilage injuries. Articular cartilage injuries demand a tailored approach, considering various factors such as age, health status, activity level, and injury severity. Treatments range from conservative measures to surgical interventions, each serving distinct purposes in alleviating symptoms and restoring joint function. Non-surgical treatment. Non-surgical interventions aim at symptom management and prevention of further degeneration. These include rest, ice application, elevation, and over-the-counter medications to alleviate pain and swelling. Utilizing braces or injections of corticosteroids and hyaluronic acid can also provide relief. Physical therapy plays a pivotal role, offering customized exercise regimens to bolster joint stability and enhance mobility. Surgical treatment. Surgery emerges as the primary recourse for significant cartilage damage, as the tissue's limited self-healing capacity warrants intervention. Arthroscopic procedures, minimally invasive, dominate surgical approaches. Arthroscopic debridement, a common procedure, involves cleansing the joint to remove debris and damaged cartilage. However, it's crucial to recognize that such interventions focus on symptom alleviation rather than reversing extensive cartilage loss, often associated with conditions like osteoarthritis. Arthroscopic debridement. In instances where cartilage damage is moderate, arthroscopic debridement suffices as a corrective measure. Through small incisions, a camera facilitates visualization, while saline irrigation flushes out debris. Debridement entails the meticulous removal of damaged cartilage, restoring joint integrity and function. This procedure, often complemented by joint lavage, aims to mitigate symptoms and prolong joint health. Microfracture. Procedure. Microfracture surgery stands as a beacon of hope for individuals grappling with localized cartilage damage, particularly in joints like the knee, hip, ankle, and shoulder. This innovative procedure targets small areas of cartilage injury, typically less than 2 square centimeters in size, aiming to spur the growth of new cartilage. During microfracture, surgeons meticulously puncture the rigid interface between the damaged cartilage and underlying bone, creating tiny channels. These channels serve as conduits for bone marrow cells to migrate to the surface and initiate the healing process. The subsequent formation of a blood clot, enriched with stem cells, acts as a scaffold for cartilage regeneration. Over time, this blood clot transforms into fibrocartilage, a resilient and elastic material that fills the void left by the damaged cartilage. Fibrocartilage effectively bridges the gap, restoring structural integrity and function to the joint. While not identical to native cartilage, fibrocartilage provides a durable solution for small cartilage lesions, offering relief and enhancing joint stability. Matrix-induced autologous chondrocyte implantation. Matrix-induced autologous chondrocyte implantation, MACI, represents a pioneering approach in the realm of articular cartilage repair, offering renewed hope for individuals grappling with cartilage damage. This sophisticated procedure unfolds in two distinct phases, harnessing the patient's own cultured cartilage cells to facilitate tissue regeneration. In the initial step, akin to autologous chondrocyte implantation, ACI, healthy cartilage cells are meticulously extracted from a non-weight-bearing region of the knee. These cells are then cultivated and nurtured on a specialized membrane over a span of several weeks. During this incubation period, the cells proliferate and mature, primed for their vital role in cartilage repair. Upon maturation, the membrane laden with cultured chondrocytes is precisely positioned within the defect site, seamlessly integrating with the surrounding tissue. This strategic placement serves as a catalyst for cartilage regeneration, fostering the growth of new tissue to replenish the damaged area. Articular cartilage, essential for smooth joint function, is prone to wear and tear from daily activities or trauma-induced injuries. MACI emerges as a beacon of innovation, offering a tailored solution to restore cartilage integrity and enhance joint mobility. Osteochondral autograft transplantation. Osteochondral autograft transplantation, OAT, emerges as a singular solution in the arsenal of articular cartilage repair techniques, offering a streamlined approach to addressing localized cartilage damage. Unlike multi-step procedures, OAT accomplishes tissue restoration in a single surgical intervention, minimizing patient discomfort and optimizing recovery. During OAT, the surgeon strategically harvests a plug of healthy tissue and underlying bone from an unaffected, non-weight-bearing region of the patient's joint. This meticulously selected graft is then delicately transferred to replace the damaged area, ensuring precise alignment and integration with the surrounding tissue. What sets OAT apart is its adaptability to diverse defect sizes and shapes. By employing multiple plugs, surgeons create a mosaic-like pattern